Hello and welcome to the video introduction to the Telemedicine Virtual Care Coding Guide. This quick orientation is just designed to give you a feel for what's included in this guide and hopefully help you understand how you can apply it within your practice. As we skip by the table of contents, we'll see an introductory and general principles section, and really what we're trying to do here is let you know that this is not intended to be a comprehensive guide or a set of recommendations for how you should do things in your practice. I'll say it right off the bat as well, you don't have to provide remote or virtual care or telemedicine services. That is completely up to you. But for those of you who would like to do it, we hope this guide serves as a good foundation for that. Beyond that, we talk about the various categories of the services, which we've grouped them into 6 of. You see there's remote image video evaluation, there's virtual check-in, there's e-visits, telephone services, telehealth visits, and interprofessional internet telephone consultations. Beneath that, we go into each one of those, providing the code, the description, and the approximate reimbursement. Now that approximate reimbursement is at the national level, so you may find the value in your level to differ slightly from that, but it should at least give you a feel or a ballpark figure for what you can expect to receive for providing one of these services. There are also key points to remember for each of these services that we discuss in the guide. After we go through those codes, we then provide clinical examples. These are not intended, again, to be recommendations of how you should do things. They're just designed to give a clinical reference for how these telemedicine and virtual care codes can be applied. As an example, you'll see as you go through the guide that if you're providing a real-time synchronous video audio conferencing system for your patients, there's probably a couple of different codes that you could use for that type of encounter. And the ultimate decision should be left to you based on what you ultimately do and how you feel about your coding habits and behaviors. After we go through the clinical examples, we also provide a summary table where you can see, again, the names of the services, the associated codes, the communication methods that are generally accepted for those codes, if live interaction is required for that code between the doctor and the patient, if new patients are allowed for that code, if the patient must initiate communication for that service or code, and then if informed consent is required. As you go through the guide, you're going to see that there are a number of services that require informed consent of the patient to receive telemedicine services. Therefore, the last section that we talk about in the guide is a sample informed consent form. Importantly, this is a sample form. It is not something you absolutely have to replicate and use, but it is there to give you a starting point and understand the considerations that are involved with informed consent for telemedicine services. One last note, all of the codes in this guide have been automatically added to your practice library. They've been in RevolutionEHR since they've been available, but for you to use them, they actually need to be within your practice library. We've done that for you. The only thing we haven't done is assigned a fee for you. That is something that you'll need to decide on, and you can add to your services inventory or library and then start applying them in practice. If you have questions at any time, please feel free to reach out to the customer support team or use the help menu in RevolutionEHR to access Ask RevAssure. We'd be happy to help you anytime.